Just push the orange button.
Okay, it's on now. Good evening, everyone, and welcome to Health and Human Service Committee. Board of Alder's New Haven notice. The Health and Human Service Committee will meet in person on Thursday, May 28, 2026, 7 p.m. in the Board of Chamber 165 Church Street, second floor, New Haven, Connecticut, to act on the following items. Item 1 dash 2026 dash 015, resolution of the Board of Alders of the City of New Haven accepting a list of program proposals applying for eligibility to receive donation under the State of Connecticut 2026 Neighborhood Assistance Act. Item number 2, LN-2026 dash 0217, order of the Haven Board of Alders authorizing the City of New Haven Mayor Controller or budget to enter into agreement continuum of care in the amount not exceeding $1,227,000 from July 1st to June 30th, 2027 to operate the Own City Campus Community Responder Program. 3. Operation. Review the contract containment upon funding availability. Item number 3, L 2026 0219. Order of the New Haven Board of Alders authorizing the City of New Haven Mayor, Controller, or Budget Director to enter into an agreement with Continuum of Care Inc. in the amount not exceeding $1,500,000 0 cents from July 4th, 2026 to June 30th, 2027 to operate the emergency housing program at 270 Fox, including 3. Option to review the contract contingent upon funding availability. These items are on file and available for public to inspect in the Office of Legislative Service, 165 Church Street, New Haven, Port Harbor. Honorable Henry Singh, Chair, assess Honorable Michael Swan, City Clerk. If you need accessibility, please contact 202-946-7651, void for 202-946-8582 TTD. In accordance with the City of New Haven COVID-19 policy, task is optional. Public may send testimony to testimony at New Haven CT. Meeting can be viewed at all YouTube. We will now call makers of item number 1. Although I will now introduce my colleagues, starting from her.
Mandy Martinelli, Ward 8.
Kenton Singh, Ward 5.
Caroline Toby Smith, Ward 9. Teresa Maria, Ward 12.
Kathy Shore, 71 East Haven, Connecticut, Deputy Director, Housing Economic Development. Thank you. These are the things. The Neighborhood Assistance Act is a State of Connecticut Department of Revenue Services program. The City of New Haven acts as a liaison between the organizations and the State of Connecticut DRS. It's a tax credit program that assists corporations that donate to organizations programs, efficiency upgrades, and for a public service oriented program that services low to middle income individuals. The attached list are the lists of proposals that were received from organizations this year. They've been reviewed for completeness and for eligibility according to the DRS requirements. We ask our committee and our legislative committee, according to the statute, that you have to approve these be submitted to the consideration and program. The state and for the program, we don't just do the administrative review for completeness, and that they need to find the program.
Thank you. Seeing none, thank you.
You're welcome. Thank you very much. Oh, and also, I'm sorry, I'm going to have to ask for a motion to discharge straight to vote. By statute, all of these need to be buffed to the state by July 1st. And because of the schedule, you all don't meet again July 16th. So it has to be on the agenda for June.
So noted.
Thank you.
I'll now call the maker of item number 2. We continue. Good evening, and state your name and address for the record, please.
Wanda Joffrey, 65 East Avenue, H1 East Haven.
John Levinick, continuing appeal 109 Leland Avenue.
Loretta Mitchell, 107 Foster Street here. Tears of Camp, 747 Mix Avenue.
Thank you. You may proceed.
Some success stories that were edicts.
So, as I mentioned, my name is Loretta Mitchell. I'm serving as the coordinator for community mental health initiatives here at the City of New Haven under the Department of Community Resilience. I'm here to share with this committee information about the Elm City Compass Team Operations contract for fiscal year 27. I'm joined by two of our Compass leadership. Do you want to just state your title?
I'm the vice president of our acute emergency response services, for which both the shelter and the
Clinical Director of Crisis and Emergency Response Services. So, I know this committee has heard about Elm City Compass before. It is a community-based initiative creating a system of sustainable supports for individuals experiencing mental health and substance use crises. It's a comprehensive program. It includes our crisis response team. It also includes components that work on the system related to mental health and crises. System providers, faith leaders, and businesses to the system. We are informed by an active advisory board of New Haven residents. And there's also a rigorous evaluation component led by teams from the consultation center. The contract in question today is really about operations, staff continuum of care. The other components of the Elm City Compass are continuing under the direction of Dr. Jack Tees, funded separately through outside and NG grants. Compass was originally launched in 2022 and year 2025 was funded by a federal BJA grant through a contract with Yale University to continue on as a subcontractor. Starting last year, this fiscal year, the city entered into an agreement directly with Continuum of Care for continuing team operations. So we're here before this committee today to request to enter into a contract with Continuum of Care to continue Compass. The program has really moved from pilot to implementation to scalability at this point. Operated 7 days a week, 8 a.m. to 3 a.m. It's operated by a 2-person team, so every shift there's somebody with lived experience. Since its inception, the team has completed 4,380 responses. The majority of these responses are related to mental health, substance use, and housing needs in our community. And I think what's really notable and what it emphasized is how much coordination is happening across our service system, thanks to the work of the team, the Compass team, and the Fox and Shelter to hear about later. In the past years, with the leadership, we've established protocols that increase coordination with the hospital, in particular the emergency department, with warming centers, and ensuring that every resident has a warm place to stay in the winter, and also increase coordination with our child crisis response system. And few years since the opening of Foxen and REST, which is the 24-hour crisis stabilization center, we've really seen the integrated operations across the whole crisis continuum. We know that Compass works very well and in close collaboration with our police, fire, and 911 dispatch. And the work of Compass frees up police to respond to criminal activity and urgent public. In terms specifically of this contract, it's mostly unchanged from fiscal year 26. The item says that the total contract amount will be $1,270,000, but we'd like to amend that. This team will be using $670,000 of general funds. Contract amount for the Board of Alders item. Additionally, the one contract would be the 3 years, obviously contingent on future funding. Otherwise, the contract will continue operations at the current level, so that's 7 days of 3 a.m. The team will continue to respond to 911 calls and fire. It also conducts extensive outreach throughout the city and all neighborhoods, particularly in places where there's identified need. There may be individuals more vulnerable to substance crises. And then our continuing partners are really incredible partners, ongoing coordination with city departments and other service providers across the city. This is an incredible service, bringing members into our centers, making sure that we meet with an appropriate professional resource. I listed the key people related to this contract. I just also want to mention that there's so much more information at citycompass.org, including monthly data reports that are uploaded for the public to see. And to reflect the motion to discharge, given the time-sensitive nature of helping execute this contract in time for the new fiscal year. And then pass it over to continuing partners in case they want to add any more sort of flavor to the presentation.
But I would just say it's pretty incredible, the robust nature into the crisis response. Given the team to respond, we have a shelter to go to on top of some of our crisis beds that we operate internally at Continuum of Care. So it's turned into a very robust system. You know, the team often refers to their relationship with the PD as a gold standard. They have a wonderful working relationship together. The PD is often calling us when we're off hours. So they definitely, I think you're seeing the value to what we bring when we are able to lead this team and let us take care of things if it's mental health related. So,
I just want to emphasize the added value of the hours that the team is available to visit and traditionally other service providers, and at 5 p.m. The team is available to respond to crisis calls via 911 to the community and out.
Not quite anything.
No. I think they said it.
Thank you. Item number 2 was presented on item number 2 also.
Yes.
Okay.
Very much. Thank you. Thank you so much. Again, Tears and Kemp, Mix Avenue, Hampton. And I'm going to present the information regarding the contract with continuum of care for fiscal year 27, emergency housing program 270,000. For those of you, I just want to make sure that everyone knows 270,000 was the former Days Inn converted in New Haven for its first large-scale non-congregate emergency housing program, purchased by the city in 2023, operated in partnership with Continuum of Care, designed to provide 24/7 emergency housing, stabilization service, housing navigation, behavioral health support, and connection to permanent housing. The property includes approximately 100 beds, and the program serves approximately 100 individuals, pets, couples, as well, which is not sometimes the norm when we think about a shelter. I just gave some non-congregate model at 275, saying, again, the individual private rooms, increased dignity and safety, better infection control, improved stabilization outcomes, and better engagement services because it's connected to Compass, the rest center, and the way we're building the system within the city. Services provided, those comprehensive support services, 24/7 staffing, background care, supervisory staff on all shifts, trauma-informed care, licensed clinicians, case management, housing coordination, nursing access, peer support specialists, and crisis intervention and escalation support. As we know, Continuum of Care has an extensive experience in operating emergency shelter and supportive housing within New Haven's homeless response system, and it's demonstrated the operational capacity and community partnerships necessary to continue to manage 275. Just wanted to provide some program highlights. Total client services section has been 565. 53% of those were over the age of 55, and as we know, and I know I've been a part of these conversations of the growing elderly population in homelessness, 48% have severe medical comorbidities, with the development of REST, which is the Crisis Stabilization Center. The shelter has deployed at least 86 unnecessary emergency rooms are utilizing REST as an alternative. And I didn't look at the cost. We're really breaking down the cost of what that would be in the emergency room. With Compass on site every evening since inception, 270 potentially diverted up to 525 911 calls for behavioral health issues. 44% of the clients connected to outpatient and inpatient treatment for mental health substance use. Over 50% of the clients resolve their homelessness issues by moving into housing and other levels of care. And the rate of individuals returning to homelessness at age 2 has been less than 15%, while the rate in traditional shelters, congregate shelters, as we call them, can be as high as 60%. And so over the past several years, New Haven has continued to experience an increased demand for emergency housing services driven by rising housing costs, limited affordable housing availability, behavioral health needs, and economic instability. Some of the challenges that we face are just those things. Rising economy, behavioral health acuity, the growing elderly population, funding stabilization, our funding setting. Our future focus will remain on permanent supportive housing expansion, increased prevention and diversion efforts, stronger regional and state partnerships, as well as sustainable funding streams. Loretta had mentioned the sustainability aspect. It's part of it now, education and now sustainability. Um, and the request for the board of aldermen tonight is to authorize the agreement with Continuum of Care to continue the operations of the emergency housing program for 275. And what I would like to do is, yes, amend the request for the what was it? 1.5 to 600,000, as well as to discharge request as well. And again, we do have all the contact information. Presentation. I don't know if you guys wanted to add anything regarding 275.
Talk about 270 all of you. Wanda and I had the pleasure of turn shelters, and Seattle being one of the first to do it before COVID hit. And they all these numbers. So it's been a very, I think, proud moment of Wanda and I to have this monster of a program be our little baby, and the success that it does bring and the challenges. I mean, I went into this now, how severe the elderly population and how sick medically. We had no idea that it was going to be as bad as it is. The only place that can accommodate some of these people, and our whole first floor has turned into wheelchairs, walkers, people with oxygen tanks, difficulty walking. Our whole first floor, that's like half of the population almost there. So that's been very eye-opening for us to see that unfold.
Anything else to add now?
Thank you, Carl.
Thank you, Chair.
So the rate of individuals, it's your last bullet point on the program highlights. It's, you say that less than 50%, 15% go back to homelessness, but when they're in congregate shelters, it's as high as 60%. Why do you think that is? Do you think see it differently?
I think that people feel safe. My experience has been that there's this philosophy that the more uncomfortable you make it for individuals, the less likely they'll stay in a shelter. We're engaging folks in treatment with dignity and respect. Get their life is worth living. To get the vibe that they can live in one day. And I think that number speaks for itself. I think traditional shelters have always run on these. And I have my own lived experience. I'm a social worker, but I can say for the fact that I've experienced in my own life, way back in my heyday, that is the case. You're not treated very well, and the thought is just make it as comfortable as possible so people want to leave. We do differently.
I think also the fact that, whereas in the congregate setting, it's one big room with 50, 60 places for them to stay. At the former hotel, it's one room for 2 individuals. It's not as hectic as that's and we're able to give them that one-on-one attention. I think especially what's helped, as you can see the numbers with the number of individuals that we have with significant substance use, we have a clinician. The leadership are all licensed clinical social workers, so that we're able to provide that additional support as well.
The sickest violence, obviously a big undertaking, so thank you for doing that. Thank you, Chair.
Any other? Go ahead,
I'll take your Chair. What is the turnaround time for an individual? Is there like a plan? And I only ask because when I had visited not long ago, and the lady said that she was there for a year, and I said, oh, didn't tell me why. She was there for over a year. Is the turnaround time?
Ironically, the states are averages around 60 days. But we have outliers, people that may have significant barriers barriers to reaching housing. We've had individuals treated for cancer who are with us, hospitalizations. We've had people that, just have the normal process is to obtain by the documents and get what they can on obtaining vouchers for housing. And when that works, it works beautifully. But as we've become this domain for the sick, traditional housing didn't work for some of our folks. We're not looking at nursing homes and different restrooms to accommodate the growing needs without a first floor. You have accessibility. There's all these challenges that come. So I would say any shelter you look at is going to have those outliers of people that are doing all the right things. They're showing up to all their appointments. They're abiding by all the rules. They just have all these barriers in front of them.
Mm-hmm.
Other barriers include, I think, criminal evictions on the record. When they have that's been one of the biggest ones where they already have an eviction on the record. When they go to apply for housing, that comes up, and that's certainly a huge barrier as well.
So when they come in, then you don't really know.
We don't know
But
what
yeah. I must say, those very well kept over there. Around the year, it's very well kept.
We've made efforts to even work with business owners throughout the area, giving them our contact numbers so that even if it's not one of our individuals there, but the homes they're struggling with unhoused individuals, we go out to help. And we've done efforts to create a volunteer system at the place that cleans up the neighborhood as well, and around the community.
And is that considered the compass part of it? Okay, so it's
I was gonna
compass,
speak on that.
continual care, and then the shelter. Is that
And rest.
everything or?
So continuum is the overarching.
Okay.
Okay, so continuum just does it all. And then, and that's what I wanted to speak to, is really understanding the continuity of the system, right? And so for the individual, we need to do homeless outreach, and then there's some, especially over as long as there's availability and housing, we're able to get them connected to that. But then there might be some issues where medically we got to get them over to rest, and then they get the transportation back from rest, back to the 270 shelter, correct. And so it is really a continuity of the system and thinking about it not just in separate, but we could have Compass and then separate 270, but the way to continuum and routine is really work together to connect all of those dots. And so I would say during the cold weather months, this was not, you didn't really see much about where they were using their Compass vans to transport. So individuals who were leaving the emergency room into a homeless situation were able to get picked up from Compass and then go out to the rest center, and then working with the other shelters within the community to be able to, if they didn't have the space, then see who else has the space. And so it really is, we can't do one without the other. We need the entire system to be successful with the people that we're serving.
So at the Foxton, I think what I can do is like one room available. But is there a certain amount of room that you have set aside for extreme emergency cases or no?
We use rest for those cases.
Okay,
yeah.
okay.
And that's how we divert these calls, because the Compass team is on there during the overlap shift. So they're stationed there, so there is an escalation usually in the second shift. Or in the evenings, they're able to be right on the floor to assist and triage things, transform people directly to rest right on that.
Thank you.
First of all, I really want to just thank you for all the work that you do. I just want to thank you and commend you all for the work that you're doing. This is something that we're in great need of. The need is growing, and oftentimes it looks like a hopeless task. Something that was beyond any of us to do. And what do we do, right? How do we clean our streets or people off of the street and back into society, right, where they can function and live and have that, right, respect that you speak of, right, and a sense of dignity and pride. So I do commend you all for the work that you do. I think it's wonderful. I think think it's something that's really needed. When I'm walking, sometimes I hear that um, we're having issues that um, folks that are suffering from, drug addiction or mental illness often do not want to go in for care. And what are some we do to one draw people is the catch that keeps folks, if you guys, what's the longest length of time that and that's something that I'd really like to know. And um, rest, I would like to understand a little bit more about rest. Is it an acronym for something?
So,
I'd like to know.
yeah, so REST stands for Rapid Evaluation, Stabilization, and Treatment. So those are the services that are provided at the program. As the first crisis stabilization center in the state, it's funded by the Department of Mental Health and Addiction Services. It's designed to be an alternative to individuals in crisis, particularly resource for local crisis teams and um, police officers, an individual in crisis. At rest, we have a clinician, a social clinician, a nurse, and a person with a specialist, a person with experience on site 24 hours. And then we also have an APRN at 40 hours a week and on call. So if needing an emergency psychiatric evaluation can come to rest at any time. Given that it's a crisis stabilization center, the length of time by contract is 23 hours and 59 minutes. I always I make sure to add those 59 minutes. However, through Continuum, we have access to other crisis beds, also funded by demons, so that if they need that longer term stay, we can help coordinate. Um, about steady, I was going to get to the engagement.
So, when you have someone for this 23 hours and 59 minutes, what is the process then to go into Continuum? And are there people that you
From rest?
from rest if they want to go on to the Continuum?
Yes.
Exactly.
So at rest, they come to the program for all sorts of crises. While housing has been the biggest percentage of the crises that individuals come to. We also service individuals for mental health crisis, substance use. We've had individuals with domestic violence crises as well. While they're there, they have the availability to be assessed, like I said, by the nurse and the social worker, and then all the appropriate resources are for individuals, for example, who are ready for substance use treatment. We have a direct connection with the Connecticut Valley Hospital. So we fast track for treatment because we know that when someone wants treatment, they have to get treatment right now. Because otherwise, then they'll fall through the cracks, or they'll be like, "Never mind, I don't want to do this right now." So we're able to make that referral to Connecticut Valley Hospital. Housing is the most difficult piece, right? Because there isn't housing available. The demand, the need is the demand. And so the way we're able to assist with housing is we are able to, through the CAN, we're able to add them directly to the shelter list, rather than having to call 211 and wait for hours and then have to wait 2 weeks for the CAN assessment. We're able to do this right then and there. And the warmer, colder months, the warming centers, we're able to kind of transition them to the warming centers and things like that. The summer months of water, right? Because those are open. But we do make sure that they have the necessary rules in place. There are no wrong doors. So if they leave and they need to come back, everyone's welcome to come for further for an assessment on ongoing resources.
If we're at capacity, we would still do our due diligence in terms of our evaluations to ensure that they don't need further hospitalization or anything like that. And then the engagement piece too, just to touch on that, takes a long time, to get somebody. And it's, I refer to it as a window of opportunity. That opens for people if you have that relationship built already and the trust building. We've seen it happen in action where they'll call us and say, "I'm ready." And the team will go out, pick up a regular rest, and we fast track them right into treatment.
Two questions. what is capacity? Um, and um, about how long does it normally take to transition them from um, homelessness to housing? Because that's the most difficult piece, right? What's the number of capacity?
For the rest center, there's 10 loungers and 2 crisis beds on site. And as Wanda mentioned, we have 21 additional crisis beds throughout the greater New Haven that we have access to that are under one. So we have that flexibility in terms of beds. That longer period for the crisis beds is 2 weeks. And we've often used that to medical preparation or to get somebody really, fast track, so to speak, that has significant barriers and complications that need to shelter bed quickly. We have working with the CAM to do that when it makes sense.
Are you guys seeking money from resources as well, grants and?
Always. I've been told to stop the building programs, my life would be threatened. But we've done a lot with the help of the city, and I always commend the city because nobody wants to pay for this type of stuff. Nobody wants to pay. But the city has really time to really think about make it work to the best of its doing, and we're seeing the results of that.
And we are having conversations with the state, with DOH, and really looking at how we can build this more coordinated system instead of how, funding gets fragmented, and nothing is really connecting, and people aren't talking to each other. And so we are having very high-level conversations with DOH to understand the needs. That's how I have to say, acknowledge that.
Thank you.
Colleagues?
Thank you, Mr. Chair. Thank you all so much for your presentation and just for being here. A few questions. One, for both Compass and for Buxton, how would you articulate what your core metrics are when you think about sort of defining outcomes that is your horizon line? For both programs, what are those defining core metrics for both programs?
Well, we have a mechanism within Fox and Boulevard to try to not do administrative discharges to prevent people, because the sabotage that happens throughout the course of someone's addiction is real. We see it happen all the time. Mechanisms in place to try to really build and create pathways for people to stay in shelter and not be discharged back to the streets. So it's all about the individual. And, I think Continuum's mission from the beginning, and I've been with them for 23 years now. And that's what brought me to the agency, is those core values that every person is a human being that has certain needs, and to address those needs and take the time to really think about we want to set people up for success, and to understand what they need. Our metrics are to give them what they need to the best part of them.
I can speak a little bit to Compass as well. I think our community advisory board always reminds us why Compass was started in the wake of George Floyd's murder and the movement for Black Lives. Like, this program is about making sure that people in crisis get the right type of support. And so the sort of main principles are: can we reduce arrests for people who are experiencing mental health and substance use crises, and can we reduce unnecessary hospitalizations? And under the leadership of Dr. Jack Teebs, we have a very, very comprehensive evaluation where we're really trying to understand if the program is doing that. And I think preliminarily the data says yes. So we're really excited about that. And I'd say in general, both of these programs are data-driven. Ton of metrics, particularly to making sure that our constituents, our residents, our community advisory board are, looking at the data and helping inform the program as well.
Thank you very much for those answers. And when you think about the the data that you do have, is there one metric that you think you're really focused on? This is really for this one. And is there one where there's a gap where it's like, in the next few years, we really love to see that improve with further investment? There's areas of growth, areas of challenge.
I think in the area of the one that we're really proud of, I think is the way that we see them for who they are and where they're at, and them, where they're at. We don't look at them as, someone who's homeless. We look at them as John, as Wanda, as Lorena, and what is it that we need and how can we best help you? I think that's one of the things that I pride, that makes me proud of being a part of Continuum.
I would take the diversion from hospital. That's always been a mission priority, even before the programs has been, because we know how traumatizing hospitalization can be for individuals. So that's always a good one. And the challenge, I would definitely say, is getting people to permanent housing. Yeah. That's definitely an area that we would like to be better at.
I was just going to add the permanent housing. I think we're talking about affordable, and that's not what we're talking about. Yeah. Right? We need deeply affordable, we need case management, we need wraparound services, we need continuous support. There's a continued investment that we absolutely need to be able to not just put a roof over someone's head, but ensure that we're creating success. That means that this person is successful because they got appointment, and this person is successful because they didn't high today. And that's how we have to do the individuals as they discuss. But if we don't have those services, some folks are not going to do well in housing on their own. If anything, it could exacerbate their mental health, their wellness, substance use, and not being able to manage it because there's a reason why they got to this place in the first place. So if we're able to really identify ways that we can find investments for housing that include all of these wraparound supports 24/7, imagine the cost of that. The truth be told is it's the cost of saving people's lives, and we don't think enough about that. And so I just really wanted to touch on that conversation.
Director Kelvin, just a couple other questions. You used a really elegant word around continuity. And I'd be curious if there's any other areas, for lack of a better bottlenecks, particularly ones that maybe are a little less intuitive, it's not really deep as well, or there's a bottleneck around permanent support housing for someone accidentally. Are there any other bottlenecks where there's a real need for investment that they might not, it may not really come to mind?
I think that in our system, we fragment people, we fragment how they say are diagnosed. And I love how Anya talked about even reentry population. So I oversee the office of prevention. And thinking about bottleneck in the system. In the Department of Community Resilience, what I'm most proud of is this department looking at all of the issues, the complexity. Someone has mental health, right? Then they also have a criminal background, and they're homeless, right? And then they were evicted in the past. And so we think about the court system and how do we clean up these evictions quicker, and making sure that they have that access to then employment, housing, and all the things that will stabilize them and get them not necessarily a hand out, but that hand up. And so I would definitely say mental health is something that's really a bottleneck. How many beds are available? Treatment is available, the wait list, housing, there's definitely a bottleneck. I know somebody who's on the wait list and someone can say, oh, I'm number 19 on the housing authority wait list, not realizing that can take someone 20 years to get housing, right? And so it's all interconnected. And my hope is that we begin, and I think Behavior is really doing this with the supportive continuum, is connecting those dots to look at the continuity of system of care, right? Where's the door that somebody is coming in? And then how do we make sure that there is no wrong door, but they get those services, right? And then how do we do it equitably? So how do we give those who have less, more resource, more service, more housing, more stability, more everything to be able to ensure they're successful?
we operate I only oversee one division for homes and levels of care. As you mentioned, we oversee 12 hours, and the bottleneck to getting into those beds is outrageous. You know, it's like a year plus to get into those beds. Definitely.
Thank you for sharing. One more question, Mr. Chair. You know, I think why I call you heroes is in some ways there can be so much stigma around this work, and I'd be curious, is there anything that you wish more people knew about what it makes to do this work, what it means to essentially be in line with one of these positions? Are there any myths that you wish could be debunked about whether it's the experiences that you work with to lead in this kind of work?
Thoughtful
Talking.
question.
The,
Sign me out of here.
Well, I think one of the things that when John mentioned earlier, how we're making, we've made connections within the businesses around the area. They're supported. The time that they called us with issues, they haven't been our clients. They automatically assume that, oh, they're coming from the shelter, and so now they're hanging out here and they're being, they're drinking or they're smoking or they're stealing, from the gas station. They were saying, oh, we had like an increase of thefts since, the shelter opened. And when they show us pictures, like obviously because of confidentiality laws, we can't confirm that they're ours, but we know internally that they're happening our company. So I think that's one of the biggest things is that, the shelter there, everyone has mental health issues, everyone has substance issues, they're going to, get in trouble, steal, do whatever, and that really hasn't been the case. Not to say that we haven't had those issues, but I think to the extent that people thought they were going to happen, they didn't happen.
I think the chronically homeless give homelessness a bad rap. A stigma because what we've seen is there's a very small portion of people who cause a lot of chaos and harm. And it's just a very small portion of the bigger issue where you have all these other people looking to get help. But this one person, because of the gas they bring, kind of gets everybody's attention right away. And it gives homelessness a bad name, I think. The other thing I'll say is that their addiction is trauma, period.
I think if you did some research on some individuals who are currently homeless, you would realize that you can go all the way back to the third grade, right? And you start looking at the test scores and you start to look at the family dynamics. The writing was on the wall. And it's interesting that the system we do, what we do, and how the system is designed. But it's that blame on the individual, and I think that's incredible. I mean, if we can just come from a place of human kindness, it would really go a long way.
Thank you all. Thank you, Mr. Chair.
Thank you, Carl. Thank you, others. I just want to commend Compass and I've seen firsthand in my neighborhood that Compass came out when I had a crisis and they did a phenomenal job. So I would like to see Compass continue to serve our community and our neighborhood.
Thank you, Mr. Chair. Okay, so my question is, do you have an idea of how much money or not, maybe a ballpark, but how much have you saved from them going to the police or to the emergency room instead? That one seems like a very large piece of the pie. We're actually saving the city money in a lot of ways, and the hospital. And on top of that, the continuity and continual, having a lot, but it seems like you guys can be a model for a larger, maybe the nation today. Not to say New Haven, but maybe it is. New Haven are more, right?
We are going to Chicago next week to kind of brag about what we're doing.
That's great to
Compass was
hear.
invited to speak at a conference.
Yeah.
That's wonderful to hear. I believe we're only as strong as we can. So, yeah, we're actually.
That can be area, but it's is tangible, we can get that number.
Mm-hmm.
We're trying to keep track of how much police time we're saving. So like right when Compass comes up to the scene, police can leave earlier than they would if Compass wasn't there. So we're tracking all of that, which can be translated into a dollar amount to some degree. And then in terms of the hospital safety plan, certainly there's a lot of coordination and conversation with hospital leadership and their data folks to understand what impact Compass and available resource has reduced emergency room or shortened emergency room.
I just feel like if you had those data points, it'd be very helpful. And the fire and chicken
Yeah.
is very powerful because you're actually saving city services funds.
I know Jack is actually working with you on, because we did hear that there's been a reduction in ED visits since we started. So Jack was working with Yale to kind of.
Okay, Chair, I could, if you do get those numbers, I'd love. When, I would love to know. Thank you.
Thank you. Any other questions?
That's a good comment, no question. That's a good comment.
Okay, any comment about the
Oh. I just honored that you started in my ward. The model, and I really hope that other areas pick up and learn from what you guys are doing. I'm so glad. No matter how much kickback I get, we hope to. Yes.
Thank you all. This time I'd like to recognize Director Eliza Hawsley here. If you'd like to come up and say something, please do. Thanks to the team.
Well, really, the teams,
Oh,
the teams that know, I will announce myself. Eliza Hall, Community Services. And really, I think they captured the work incredibly well. What I would just add is that it really does take the whole team, a large ecosystem to make this work. And I think part of the reason we were successful advocating for $900,000 for 270 Foxton from the state and $600,000 for Elm City Compass is that our ecosystem, all of our homeless service partners here in the city helped advocate. They were all up at the Capitol saying 270 Foxton, Elm City Compass are critical to our community, and not just our community, for the state. So I do just want to echo what I heard everyone say about the importance of the importance of really building that continuum of supports. It's a good name for continuum of care because really that's what over 2 years the team has been working really hard to build. And I would add also that we got more than $300,000 extra cold weather funding. Say, listen, if we don't want to turn people away when it's cold, here's what we need. All those beds were filled. We were going all night, but I mean, the amount of time that we spend with this team is pretty remarkable. And so just want to say a huge kudos to everybody. This is a passion project. Everybody's hearts are really invested in serving some of our most vulnerable folks. So we're grateful for the ongoing support from the Board of Alders and from the city. And really do hope to continue building that early success because it's been a long, hard 2 years. But we are grateful to our partners and your CC team.
thank you. It's our city has been facing challenge with houses. Our city does stepped up in the city of compassion and with the staff and campus, like I said, there's work to be done and have to continue working. I want to say thank you.
Thank you.
Thank you.
So yeah, just the one other thing I would reiterate is just in terms of timing, we know this budget process is always challenging. And we appreciate the committee's consideration as we work towards
your consideration before.
Thank you so much for your time.
Got one question.
We'll now take public testimony. Jack. T. Jack T.
I'm here with, I'm Jack Tees. I'm here with two members of the advisory
Please
board.
come on.
All come up.
Please come up.
Made more sense.
Please come up. Make more sense.
I'm Jack Tees. My address is 389 Whitney Avenue, New Haven. I'm here as director of the Elm City Compass Initiative in support of Continuum's contract for Elm City Compass with the city. When we developed Compass 4 years ago, it was always about Compass crisis team being part of our system, supports across New Haven for people in crisis. A system that was responsive to community feedback and guided by data. With your support, Board of Alders support, and guidance from the Community Services Administration and the New Haven PD and FD, we've accomplished much. Together, we've created that broader system, one that is becoming a model for other cities. Dozens of New Haven agencies, the PD and FD, hospital, CMHC, our library branches, and centers, and all of our shelters and women's centers have come to rely on Compass and 270 Fox to make that system. But more importantly, the people that all those agencies serve, they rely on Compass 275. So in fact, the data survey we did, organizations that provide services and supports in just recently found that Compass is the most effective organization in our city for crisis services. Also, Compass, Continuous Rest Program, and the city's Community Services Administration are the top bridging organizations for crisis services in our city. And by a bridging organization, that means they're connected to all the other organizations that help make crisis work. So what you have the city government at the center of bridging to other organizations, CSA, its offices, and its departments. But we also have an organization like the Crisis Center, 270 Foxton, the shelter, the extended day shelter, but Compass, all making those connections with all those other organizations. So in order to provide stability to the system that we all built together, we need Board of Education, Board of Alders, different committee, Board of Alders approval for Continuum's contract for the crisis team to be renewable across multiple years, so that the organizations that rely on Compass and the people that they serve can rely on Compass all into the future. And this will ensure that our crisis remains strong. So thank you for the opportunity to support these resolutions. And so happy, one of our community advisory board members, Billy, coordinates our community advisory board.
Okay, thank you all. I just want to hand out, oh, sorry, Billy Rummage on 49 West Rock Avenue. I just want to hand out for you all to see a few of our community advisory board members couldn't be tonight. So I just want to, there's two different ones. I think one more of our community advisory board members submitted it. So my main job is working with the community advisory board. Angela will probably talk a little bit more about that. It's a group of very committed New Haven residents who board to make sure that, advise Compass is reflecting feedback from all over the city. As part of our community outreach prior to Compass start, did a really extensive call out to people across the city and that long interview process to get people that would represent all kinds of different demographics and neighborhoods across the city. That group still exists. I can't commend it enough on the work of that group, the dedication of people to roll up their sleeves now for over 3 years, come together and advise Compass. So that's really also what I want to say. I just wanted to add in when we go out across the city, we're in Angeles, one from 80 people that does it, but we go across all the community festivals that are happening, health fairs, multiple things happening to keep us. That's great to get feedback about Compass and have conversations, not just hand out people to the website, which are both helpful, but really get conversations and just spread word about Compass that way. We hear, I just wanted a couple of things we hear consistently are having an option that's not the police is critical in this space. Like we hear that constantly. Almost everyone that comes up to us says, having something finally that's not the police responding. When I, or in a lot of cases, my family member in a crisis, in a situation that could lead to the fact that having something else that is just critical in our community here across the and also support for an organization that can come out and fill the space. A few of the presenters earlier talked about it, but to fill the space in the hours when a lot of the outreaches and a lot of other programs are happening, and it's at a pace that they can get out there quickly. The responses that piece is really critical. And also just wanted to say that we don't hear as much about 270, representing Compass out there, but 270 certainly is a we all know this last winter was brutal in New Haven. It was a survival race for a lot of residents in the city. Some kids didn't survive out on the streets. Some lost their toes and different things and spent out in the hospital. While we're getting it right, we got a lot of work to do. Obviously, we can get it right for our residents, but while we're doing that, I think the 270 is a critical place during the winter so people are inside and at least safe. When the cold weather hit, it was really there are a lot less people using 270s. So, thank you for the time and thank you for considering this contract.
Good evening, everyone. I'm Angela, 292 Greenwich Avenue. Canton thing. I'm here tonight because I'd like to also add my voice to the plea to please renew this contract. I've been a member of the community election board that answered that call to come and Compass is what evolved after all those meetings that we had. And I'm very proud of Compass actually. We did save all lives. As Billy said, I go out to invest to make sure that people know about Compass. That's our biggest thing is making sure people are aware that this service is there and it's and it's free. And it is, as I mentioned, it's people don't want their loved ones something that happened to them because they just get some help. And they look at news from Hartford and other cities that have had very unfortunate outcomes with patients, and that's what sticks in their mind. Because I've had one lady, she says her son has his issues and she will not talk to police, and she was just so thankful to know that an option did exist. Past couple weeks ago, we had a health test. I was at a community fest getting the word out a couple weeks ago, and I just called him up, come on over here, come on. You know about Compass? And the guy came and I was explaining to him what our mission was, and he looked at me and he said, "You're too late. I needed you 2 weeks ago." And he walked away. He couldn't, he was very emotional, and told me he would come back later and we could talk. But I guess it was too much and I didn't want to push him, you know, but it hurt me to know that our service exists and we can help. I don't know what happened with his son. I can just imagine something horrible. It's just anyway, we are here and we have gone from organization that police looked at with apprehension when we first came on to now they're calling for Compass and they do realize that we are a help and they're not trained for all of this. To have a partner that they can call and rely on and know that they're leaving these people in good hands. I think that says a lot. So we've come a long way and we just need to be. Thank you very much for your time.
Yeah, this help, so the community, serving the country. Very important, and thank you, and keep on the good work. Ms. Green? Teresa Green? Okay. Is there anyone in the public like to testify? For the second time, anyone in the public like to testify? Anyone in the public like to testify to this? Hearing none, do I hear a motion to the
Second.
public portion of the vote?
Yeah, one is up to 600, one's up to 670. Yeah. Yes. To change those numbers. So I need seconds. I'll change the numbers to the numbers that were presented by the city staff.
Council, you have an amendment on the floor. It was proposed at 1,270,000, it was to amend it to $670,000 and item two. Do I hear a motion to amend that?
So moved. Second.
Motion has been moved and seconded and amended to the current number of $670,000. Item number three, do I hear a motion to amend the 1,500,000 that was presented, that was amended to 600,000.
Okay.
We move in second, so it reflects, that 1,500,000 5,000 has been amended to 6.
You vote on those, Chair?
Yes.
Been moved and seconded, any discussion on the movement?
Any discussion in the movement? All in favor?
Aye.
Aye.
Also. Any other discussion? A motion? Motion to the.
They want them discharged,
Yeah, we
Mr. Chair, so you don't need to take any further action except to adjourn.
Motion to approve.
So moved.
Thank you, colleagues.
You're going to adjourn.
Or adjourn.